All right, good evening, everyone. I'm going to call to order this regular meeting of the Dunn County Health and Human Services Board for May 26th, 2022. Let the record show that every member of the committee is present. We need to approve the minutes. They were in your packet for April 28th. I need a motion from Supervisor Steen.
I so move.
Is there a second? Ms. Barker seconds. Any additions or corrections to the minutes from April 28th? If not, all in favor, say aye. Aye. Any opposed? The minutes for April 28th are approved. I assume we do not have any public comment.
I don't believe so.
All right, no public comment for tonight. Our next meeting is set for June 23rd. 2022, again, the fourth Thursday of June, unless I hear any concerns from the committee. All right, we're already to number 6, Veterans Service. For your report, Greg, you are on. Thank you.
Good evening, everyone. I had those that are attending in person, I'd handed out a paper copy of today's report. Dr. Hall, I emailed out, and hopefully you have that as well. The one document you're missing is I have a Memorial Day programs list that was not emailed out with that. So I'll start. If you can look at the top document, is just a brief narrative regarding activities in the last month. And again, how I break down the report for our office is identified by categories: local activities, state, federal. Then we'll hit the financial piece of that. And this last month, probably the biggest highlight I would say is a lot of uptick in contact for the office, and that's if we just kind of analyze based upon past years as we head into any type of a significant veteran related holiday. There's a lot more activity as far as individuals contacting the office, inquiring about benefits for themselves, benefits for loved ones, family members, all the way down to even genealogy questions, as well as ensuring that their loved one's grave is marked appropriately. And so I just wanted to take time to just identify the efforts that go into just coordinating that. So we get, again, utilize tons of volunteers, and I'll talk a little bit more in depth when we get into the impact statement for the office. But with going ahead and identifying every one of the graves within Dunn County, there's roughly over 70 some cemeteries. And what our responsibility, and we take it seriously, is to ensure that as everyone in the county drives by the cemeteries, they're going to see a flag that flies right next to a grave that symbolizes that individual, and we're honoring that individual for their service to the country. But there's volunteers that you will see out there, rain or shine, walkers to canes, that they are so dedicated to putting that out. And there's over 30 some volunteers that do that. And we actually have individuals come in and they count out. So there's close to about 5,000 that are dispersed throughout the counties. And we'll even, I'll probably have a couple messages as people concerned that there might not be one on their loved one's grave, but it can't always coordinate and track that if we have a veteran that is coming from another area, but Dunn County was their home and they're coming back to be interned in Dunn County. We don't get a email like, hey, they're coming back here. So we'll get notified by either the volunteer, the sexton of the cemetery, to even maybe a local family member that's going out to put flowers on it. So we'll make sure that happens. But I think it's an important thing. It symbolizes an individual's service. It's great to take pause one day a year, but it ends up being more like a month to make sure that happens so people can honor honor their fellow veterans. So, and I'll speak a little bit more about during the impact statement, but on the state benefits, there's nothing significant to report regarding the state benefits. There's typically there's a lot of usage of the Wisconsin GI Bill, which is an education benefit that dependents and veterans can be eligible for and utilize. And we work with Stout and the Chippewa Valley Tech to Eau Claire and many other state schools. The federal benefits, I've indicated nothing significant to report, but it doesn't match up with what I put underneath the local section, because I identified the Board of Veterans Appeals, a section of the VA that handles appeals. There's been an extensive backlog and waiting for some of the appeals hearings, and to be able to get the veteran to provide their testimony to have an approval. And I've probably scheduled over 6 in the last 2 to 3 weeks over the next 2 to 3 months, which is very, very good. But it does place a lot of preparation time on it, because when you wait 3 years, you want to make sure that you're prepared and you have everything right, and the veteran is prepared for their testimony and any additional evidence to go forward to that veterans law judge. And budget, and I think I'll speaking for my other cohorts here, we've got some deadlines that are fast approaching for our preparation. First draft is due June 3rd. Tomorrow's new positions that are due. And we're fully staffed, all 2 of us, with 2 volunteers, not counting all of the other volunteers that have helped over the last month for the honoring all the veterans. So the next page starts off. So what I've provided you is the actual visual of what I see. So you can kind of see what within our accounting software, what it looks like. And so this is the revenue section, and from our training earlier, the Veterans Office is primarily tax levy dollars that support that program. There's Chapter 45 state statute for some mandatory services that are within that. And we have, I'd say probably it's about 95% tax levy. I think that's an important piece of information. And within the revenue, what we take in donations for medical equipment, as well as for a variety of other reasons when individuals want to donate funds, and that goes into the Veterans Relief Fund. And then we sell some flags. Although if anybody's going to watch this later, if you're looking for a 3x5 or a 5x8 flag, they're on back order for about 2 months. So we don't have any. So if there's no questions about the revenues, I'll jump into the expenditures, which is the next document. There's 2 pages with that. And I apologize for the copier. I just needed to clean the screen a little bit better. So it's a little.
It looks fine.
Okay. All right. So I have highlighted on your guys' document the shaded areas. So within our expenditures, there's 3 main cost centers. One is for the operations costs, and that's where the shaded mark is. As you look north on that document, there's as we go through the budget process, and when we speak in August, you'll see that there's a small section that we actually have some say over outside of the staff costs, benefits costs. And so I'll explain a lot of that in more detail, but specifically there's no concern at all at this stage of the budget year to having any issues with the budget. But that first cost center is operations. If you flip the page, it is another highlighted area. It kind of goes back to the previous page, but we have a veterans relief cost center, and that it's $13,146 that we will use for transportation costs for veterans to get to medical appointments and any other potential relief. And that's utility assistance, rental assistance, and the requirement is they have to actually prove that there is the need, and we're the funder of last resort. That's what our approach is. We've been very fortunate. One of the positive things of the pandemic is was a huge influx of other funds in with other organizations. So we didn't need to use as much of the Veterans Relief Funds last fiscal year. So we'll see how this trends out this year as things are starting to kind of trend a little bit back more normal. As you go down, the other highlighted area is grants fund. It's listed as a $10,000 budgeted grant. We've already received the revenue for that. We use that a little bit of salary in that section. We use that to cover some other operating expenses. That's kind of some of the rules of thumb. If we're using it for any operating supplies, has to have a phone number, office information on. That's a kind of the grant information, because it's used for outreach, marketing, a little marketing piece on that. So that kind of explains that. And then the overall bottom highlighted across left to right, total budget expense is the next column, budget remaining, and then the percentage in the far right. Any questions regarding my explanation of the current budget costs?
Any questions for Greg? Supervisor Steen?
Yeah, not with what you just talked about, but I got a question about our interns.
Mhm.
And they're non-paid, right?
Yes, except the last one, interns are not paid, but the person came to our office to do an internship, but she was using a federal education benefit, their husband. And so I actually was able to get her paid as a work study student through the federal VA, because we're work site supervisor.
And I get, as a follow-up, I was wondering if there's any program through the VA that would allow for payment for interns.
Only through their work study program.
Okay.
Yeah.
Thank you.
Yep.
Other questions for Greg on budget or others?
Yeah, I got one.
Supervisor Steen?
Hey, Greg, where are you hiding the appeals and turn downs in your in your impact sheet there? You know, you changed that.
Yeah. So we're hoping to be able to identify that information more in the open actions
Okay.
item. We had changed.
That's what I thought. But
Yeah, we had changed software companies, which has been a good smooth transition, and the technology works very, very seamlessly. So that's a positive, but it zeros across open actions under 11 because I'm using that as a placeholder, because they have informed us that they're going to be updating their like ad hoc reports. And that's where we want to be able to pull that data. So the compromise, I put some of that retroactive payment money to kind of show some dollars in there. That's real money that comes into somebody's pocket for the month.
So I'm
Well-
sorry, go ahead, please.
Well,
Supervisor
thank you
Steen.
for that, Greg. And just for the new members of the board, I ask this question almost every month on where we're at on appeals and turn downs and all that stuff, because I think it's pretty important. And so I'm interested in where we're at on that, so
Mhm.
thank you.
Yep.
And just to follow on, if I may, Greg, so the other numbers are accurate given the new software. It's just that zeroed out line that is problematic.
Yes, yeah, with the change, the report that I've been using the last 3-4
Yeah.
years, we're able to pull that information out of the previous software and move into the new one. We've got to work a little bit, and so some of the stuff didn't transition forward. So as example, just a kind of a easier explanation. So if we submitted a claim with the other software last year, it didn't get approved until 2022. We've got to do a little bit of manual stuff to be able to capture that data, because it shows the action was taken last year. And if we could probably capture it if we wanted to pay for the other software for another year or two to have both, but we don't want to do that. So we'll get that part cleaned up to better accurately reflect the activities. Since we're talking, we move forward to the activities report. And again, we try to quantify things best we can within the office. to just really show how many individuals we have impact, how many files that we work on, new applications on things when we're looking at like healthcare, enrollment to burial benefits, and then it's some of the stuff we're still, it's accurate, but we still need to get their ad hoc report finalized so we can get you better information. Tell a better story about what is actually happening in the office. So with the impact statement, I kind of talked a little bit about some of the Memorial Day activities. And again, another piece we're part of. I just thought it'd be informative to let you know that there should be some ground being moved. As you look at the flagpoles out front, we've been working probably 3 years to try to get the Eternal Flame Memorial done. We have a nice infusion of money through donations. It's all being managed through the VFW 1039 in town because they're a nonprofit, so they can give people that donate, they can give them necessary tax documents. So Accurate Construction is the one that the committee that we have decided to go with. And so hopefully there'll be some ground moved, a pad, 800 square foot round circle pad, extension of the sidewalk to it, kind of right in front as you drive in. And then they're going to stain in a gold star. And then hopefully by the end of the year, we'll get the granite benches. Centerpiece is question mark, depends on how easy it's going to be to get granite out of India. And the cost of that. That's where the black granite comes from. We haven't got an updated bid on that. The
Wow.
benches went up like almost $1,000 from last year's with everything. So just to kind of an update. So that's what there should be some earth being moved here in the next month. And I've already went over a bit about the flags, volunteers and stuff that going out for Memorial Day. Any questions regarding this impact statement, this overall report?
Ms. Barker.
Greg, I just wanted to let you know, I met with a family at work, and I was trying to help them navigate getting services for their child at school. And the father shared with us the fact that he was a veteran and some of the things that he had gone through. And, being part of the board, I said, hey, have you talked to, oh no, they praised you up and down in your office. I thought you'd like to know that,
Thank you.
he felt like his needs are being met and he knows he has an advocate.
Good.
And so I just wanted you to know that.
Good.
Thank you for sharing that, Ms. Barker. Any other questions or comments for Greg? Anything else you need to add, sir?
Nope, that concludes my report. Thanks.
All right, as usual, an excellent report. Thank you, Greg. Moving on, item number 7, the Department of Public Health Staff Report.
Good
Ms.
deal. So-
Gallagher.
Thank you for that. I am passing around a handout instead of having it emailed to you guys. You do have it in paper. Dr. Hall, I did just email that to you so that you would receive it as well. So it is a little bit long, but I wanted to share a client success in its entirety. And so you have a fairly long narrative from one of our recent graduates from Nurse Family Partnership. So if you'll indulge me, I think it's really important to see how transformational that personal nurse in the life of a new mom and family can be. And so that is there in its entirety. Otherwise, you are seeing just the gamut of what we typically do. We are working with quite a few communicable diseases, not just COVID. So there's an update on Salmonella and peanut butter. If you guys don't already put your peanut butter in your fridge, please do. You don't? Oh my
No,
gosh. No.
No,
Really?
No, put peanut butter in the fridge?
Yes. Well, I'm so glad you guys have not had
Well.
salmonella. So this is probably the 3rd salmonella outbreak associated with peanut butter. So this one is currently Jif, but it's been a couple. So just as an FYI, public service announcement, please refrigerate it. There you go. Also, a quick update on monkeypox, because I've received a lot of questions about that. Is absolutely in the news. There's really minimal risk to general population. It's the outbreak they're starting to trace looks like it's substantially travel related. There are some secondary cases that they're trying to understand a little bit better, but as a member of the general public, not real high risk. And then I wanted to share a little bit about high path avian influenza. We did have a positive flock here in Dunn County in a backyard flock. That family worked very closely with Department of Agriculture, Trade and Consumer Protection. They culled their own birds, which is really hard because in a backyard flock, oftentimes those are like pets. So we are continuing to work with the family to make sure that we don't have any symptoms in the family, not because avian influenza is of concern necessarily to people with healthy immune systems, but they could then spread that to another set of birds. And so that's really the concern. Yes, sir.
In Colfax there, we have, I think, 3 or 4 families that are raising chickens in town. And so how should I react, or how should we react to this fact, or shouldn't we?
So Supervisor Steen, we actually have 415 backyard licensed flocks in Dunn County. That's 25 birds or more. So we did send out outreach to every single flock that we have licensed to make sure that they knew what to look for. And so my ask for you is, if you have somebody that you know and love that has a backyard flock, is that you encourage them to really consider what we call biosecurity. So specifically keeping their chickens in enclosed areas, making sure that there isn't as much access to wild birds, which is really the concern, migratory birds and that interaction. But when they go spend time with their chickens, that they're mindful that maybe they have, kind of like Mr. Rogers, a new pair of shoes that they put on before they go out to the coop and then come back in, and that they wash their hands before and afterwards. So the real risk is not necessarily because you live in Colfax and there are chickens, but it is mostly for those chicken owners and their access to wild birds, if that's helpful.
That information that you just imparted here.
Your microphone, Supervisor Steen.
That information that you just gave me, could you send that to Lynn Nigman over there? So we could perhaps send it out to the chicken raisers?
Absolutely. So what we sent to the licensed flocks, I can send that to the county clerks as well, or the township clerks. Thank you.
I got a sister-in-law that raised chickens, so I gotta be careful.
As Gallagher and I talked about this case last week, DATCAP uses the unfortunate terminology of depopulation.
Yeah.
To refer to the action that has to be taken to the domestic flocks.
Yes, sir.
Yes, Supervisor Hagan.
I was wondering, is there any recommendations for outdoor bird feeders or bird baths or any other like wildlife congregate facilities that people may have in their backyard?
So I know that some of the backyard birders have not been happy about that, but there is the recommendation to not feed and not have that congregate setting in the backyard. And I know that there's a lot of strong feelings on both sides. Transmission among wild birds happens, and we have had wild birds, including I think we had an owl up in one of the adjacent counties, but also in Wisconsin, we've had birds of prey and some songbirds that have tested positive. And so that is the encouragement, because in some species, it is 100% fatal, including chickens. Where it's challenging is that it is asymptomatic in ducks. And so if you have that congregation, then you have that transmission. I would also share that Salmonella, going back to that, if you wanted to be mindful of chickens, we always have Salmonella outbreaks associated with chicks and baby ducks. So another FYI public service announcement, don't kiss the chickens.
Thank you.
Anything else? Go ahead, please.
On communicable diseases. And then you have a bunch of our staff updates. I do want to share, I'm really excited about this. We received a workforce development grant really focusing on meeting our community needs and where they're at. And so we were able to use that workforce development grant to pay for the next year of video translation services. So instead of having to coordinate with one of our ASL interpreters or one of our Hmong or Spanish interpreters, we actually can just use that video translation. And every now and again, we have some unusual languages that come in and we can meet their need instead of having a family member. So for example, we have a client who speaks a version of Creole between Spanish and another indigenous language. That's a really hard language to translate. And so we were relying on family members. And when you're talking about sensitive things like reproductive health, that's maybe something you want to have the conversation with the provider, not in the room with, say, a child or a significant other. And so this gives us the ability to really meet that community need in a very different way. And I'm very excited for that. And then workforce development, I think, is another thing that I wanted to share about our engagement with UWEC and UW Stout. We did host some student shadow folks, and we're able to kind of show them what it would look like as a day in life with an inspector, hopefully to help inform, hopefully they fell in love with governmental public health and they want to be health inspectors, but if not, they absolutely know and they don't waste their time on that. So there's also a really nice statement in there from one of the students that we had shadowing. So I think that's all I wanted to call out for you guys today. I do obviously have stuff in there about COVID. You guys can look at those graphics and some of the other tidbits that we do just as general course of doing business. Any questions?
Are there any questions for KT Gallagher? No, I guess not. Moving on.
Wonderful. You guys do have also in the packet the financial report for the health department. My apologies. Typically this is in landscape. Today it's in portrait, but it is the same. We are looking at revenues through about 3 months. As we've talked about, the vast majority of our grants are actually allocations from the state. We bill to the state for that grant allocation, and then we receive the revenue. So we are behind on that, but still looking at an overall sum total of about 200,000 in excess that we would either carry forward or put back to general fund if we continue to spend and get revenues in the way that we have for the last 3 to 5 months. Any questions on that?
Any questions on budget revenues or expenditures for the health department? Supervisor Steen looks like he has a question. Microphone.
Excuse me. The 200 grand, is that included in the 1.2 perspective for the Human Services Department? Okay, that answers my question. Thank you.
Completely separate.
Completely separate budgets.
The health department is not part of the Human Services Department at
We've
this.
had that discussion like 3 times today.
Yeah.
At this time. No, thank you.
All right. Thank you, guys.
Norwegian.
Oh,
I have a question.
Dr. Hall has a question.
Hi, sorry. So in the budget document, so looking for at the year-end projections, and I just noticed that under the administration, it looks like we're projecting a bit higher than budgeted, and I was just wondering kind of what that's attributable to.
fantastic question. So thank you for that. So there are some, I would say, movements of people if they go through HR and then the budget kind of catches up. They get dropped into admin as a starting place, and then they get appropriately moved. So we had to move some of our contact tracers. We had to move some of our new hires. And so they're still doing that cleanup to make sure that it does flesh out and goes where it needs to be. But thank you for calling that out.
Other budget related questions? If not, thank you, KT. Excellent report. Appreciate it. The Department of Human Services.
All right. Well, we intentionally tried to stay a little shorter tonight for you because Some of our new members have been in orientation since 4:30, so it makes for a long evening. So I just have a few quick updates. One, the long-awaited Dunn County Housing Study facilitated by West Central Regional Planning has contracts signed in hand, and we are going to have a kickoff meeting of the advisory committee on June 6th. And so that will be moving forward finally. So I have been talking with you on a regular basis about the fact that since shortly after the beginning of the pandemic, people who had applied for and were receiving Medicaid benefits have not been subject to having those applications reviewed. They've just been extended. And so those extensions are tied to the federal public health emergency. And that was also just extended through October 15th. So the very next time, or the next time that it's possible that people would have a review of their Medicaid eligibility would be not until starting in October. And again, we've talked about this because people have become accustomed to having a benefit, whether or not they might remain eligible for that. Entities like the Neighbors of Dunn County may well have people who have been determined to be eligible for Medicaid, who may lose their Medicaid eligibility when reviews and renewals are in place. And so it's going to be I think a pretty steep cliff for a lot of people. Yes, Andrew.
Yes, Supervisor Hagan.
Yeah, I was just wondering, with that timeline to October, I don't know what paperwork people would need in place, but what time before then do you think people should have their ducks in a row? Do you assume?
So what will happen is the state administering the Medicaid program has been trying to plan for that, but the date keeps moving. The idea would be that they would create sort of a rolling renewal period so that everyone who had come on board over the last 2+ years would not all renew at the same time. So they would create then a system for notifying people that they had a renewal coming up. And so they would have time to gather whatever documentation that they needed before that time.
Thank you.
So another up and coming change is on July 23rd, 988 will become a mechanism that you can utilize to access the National Suicide Prevention Hotline. So just like 911, 411, those types of resources, all you'd have to do is dial 988. In fact, if you dialed it now, I think it works, but it will they'll start to publicize it as the number at that point in time. Right now, if you call the National Suicide Prevention Lifeline, historically those calls have been answered by call centers around the country, but condensed. So like maybe your call would have been picked up by a call center in Tennessee or New England somewhere. Starting in July, the calls will be routed to the state where the call originates from. So Family Services, which is an entity in eastern part of the state near Green Bay, has received the contract to become the National Lifeline call receivers. So basically you call 988, the call gets transitioned through to Family Services. They will answer the call. And then they have protocols in place to either get it to local crisis response or to 911 call center. And so they're not going to start to publish or publicize that number quite yet because the rollout has been complex. And they want to make sure that all of the 911 communication centers have protocol, well-established protocols in place. There are a number of organizations nationwide which deal with creating uniformity in the way that your 911 call is handled. And those organizations are the National Emergency Number Association, NEMA, NINA, is one of them. They are actually working out sort of like protocols and standards for the 911 centers. And so there's a lot of behind the scenes work that's happening that's not going to necessarily be done by July, but the process will work in July to call 911 and end up with at least response from your state. And then the last thing that I want to share with you, so I have to defer to KT. So because I can't play a video, minimize my screen and play a video and record at the same time. So the City of Menominee Police Department has been working for some time on a collaborative effort that's been named Project Hope. It's really looking at developing resources to do early prevention, early intervention, and deferral of people who have substance use issues out of largely the criminal justice system, but trying to get them to treatment earlier. And so it starts with everything from providing what's called BOTVIN, which is the name of the company, BOTVIN life skills training at the middle school level. So the officers from the Menominee Police Department have gone into the middle schools in Menominee and worked with every 6th grade class over a many-week curriculum that's aimed at just giving them good life skills. The program has very strong evidence base of its effectiveness in actually navigating life better and as a mechanism for reducing substance use in the future. We also were working with the Menominee Police Department on a project that's called QRT, Quick Response Teams. So basically following a overdose or a serious medical incident related to substance use, or we will deploy a mental health or substance use professional, law enforcement officer, and a fire medic to go and do kind of a follow-up with the person in person and try to get them into a treatment resource and knock down some of the barriers that might be to that. So there are a number of projects related to Project Hope, but we received some grant money earlier this year in the form of what's called the Wisconsin Youth Prevention Grant. And we wanted to do some promotional work around Project Hope. And so the capstone, they're not digital market, video students at Stout put together a PS public service announcement for us. And I'm going to make KT the speaker so it plays. And I thought we would, how did we end up with? I can do that. I can be confused too. Okay, there's you, and I don't know how to make you. Maybe it'll come naturally when you're the
It might.
speaker.
It should.
There you go. And it does say it's 11 minutes long. We're not going to watch the whole 11 minutes because part of it is the Stout students kind of discussion afterwards, but we'll watch the short public service. We are. Did you share the sound?
There we go.
Most addicts, alcoholics, they want to talk about their addiction. It took over their entire lives, and they were so selfish. It wasn't about the people, and it really wasn't like me, but it was like my life was the substance. So originally my connection with Project Hope was when I worked at Arbor Place in the prevention office. I was working with the community with multiple programs, multiple coalitions, multiple meetings, not only Arbor Place, but the Menominee Police Department.
Project Hope really means everything to me. It's a culmination of seeing how substance use addiction has really ruined families, communities, and created a cycle of violence, crime, in a variety of families. And what Project Hope does is it helps break all of those cycles.
I think Project Hope is really wants to encompass the entire community, starting from the elementary students or younger, really working through the entire school. Botfin Life Skills, it was really fun to teach. Also helped build, just build some of those relationships. I don't know that I would have had any other opportunity to get into the 6th grade class to meet all of the 6th graders. That was super helpful, and as well as just them getting the education part. There were a lot of times where students asked great questions. They didn't know some of the things that we were teaching, and trying to get them to just retain that and work on that throughout their middle school. Yeah, so some of the activities include, we've been sending some kids to the Machine Shed, which is a CrossFit place here in Menominee.
There was a transition period, but he was like, "No, this is gonna work. We got to go with it."
We had one of the participants from Project Hope actually. Now, he has no idea that anything therapeutic was ever happening when he was in here, right? But for me to see that change from day one, where they come in and they've got a complete disregard for authority, for structure, for attendance, for punctuality. He has a job, right? He asks for help. He's saving money to buy his first car, and he's showing up for school and he's getting good grades. And just to see him step up and kind of become a leader, so to speak, he's gonna do okay. Just me with my background and knowing Mayor Connect for a while, we worked together on a few different things, and he's great. We really, really like him.
Project Hope gives the opportunity for those that want help to get away from substance abuse and all of the other facets that might destroy a home life. People that are being bullied in school, or people that don't have a driver's license, or individuals that don't have a job. Project Hope gives them exactly that. Right now, the collaboration with the school systems, the human services, and others around Menominee has been amazing.
Given the role that I do here at Human Services, I'm meeting with kids and families after they've already gotten into trouble. So after they've already maybe committed crimes, or after they've already been habitually truant from school. That's when I meet with the kids and the families. So being a part of the youth response team through Project Hope, we focus on prevention. So it's kind of cool for me to be able to work with some of those kids or families ahead of the game, and maybe hope that I won't see them in the future.
We do have some ability now to start up front with services, and how do we do this short-term safety plans so that we can get parents into treatment and still keep them together. Addiction is something I wouldn't wish on anyone. Realistically, there's no parent that comes into this and says, "Oh, I hope that I'm addicted to something and that my kid suffers from it,"
The real gift of it would be is that when I'm long gone, to see the program continue to grow and evolve, and helping those that need that extra push, or at least that extended hand that says we're here for you. Because when we're all doing well, the community does well.
So if you've got a loved one or a family member that needs help, direct them towards Project Hope. And with all that we have coming together with Project Hope, it will be a success in the future. Thank you.
I'm hoping that more business owners that do work with the kids want to somehow get involved with this, especially somebody that's in recovery that wants to help with it, to be able to help other people or even help the kids, that would be huge. Because, I mean, literally, if you want to use the word hope, they're our next hope for a clean community.
That's nice. Thank you for sharing.
Yeah, and the actually after this, the Stout students speak to their experience of just like they were very proud of their work.
As they should be. That's nice.
The last thing, so financially, you just have a summary. Again, we don't print for you the whole report every single month because the line items don't change, but I try to do it about every second or third month. But you do get the summary. So the quick roll-up summary, the only difference between the two is one shows you sort of month by month expenditures and revenues, and then the smaller one shows you totals. So we budgeted $14,283,000. We're spending at $13,550,000. And we are anticipating receiving more revenue than we had budgeted for. So at this point in time, all things being considered, very early in the year, we would return about $1.2 million to the general fund. And then the other thing that I wanted to share with you is I put together this document that I just handed out to the members who weren't in the orientation. I know sometimes we've had questions about sort of the concept of grants or allocations. As KT indicated, most of what we call grants aren't as you would typically think about a grant. You think about writing to print perhaps the Otto Bremer Foundation or the Catherine P. MacArthur Foundation or something for a grant. Very little, almost none of what we do is actually grant. We receive a very small $500 Knights of Columbus grant, occasionally received community foundation money if someone applies for it. But almost everything that we receive is actually an allocation coming to us from the state, or it's money that the state grants out to counties to do particular projects. And so I just did a list of the 2022 grants / allocations and a brief summary of what they were for, what the granting entity or the state and agency is, where the money is coming from, and then the dollar amount. So it's really just for your reference.
Dr. Hall.
Thank you. So my question is, so if these are grant funds from the state or allocations from the state, does that mean then that they're meant to be continual, like not like a grant, like usually a grant you get funded for a period of 3 years or 5 years? Does that mean we're expecting these funding streams to continue indefinitely, or do many of them have kind of a sunset date?
Great question. A little bit of both. So base allocations, we call them, that come from the Department of Children and Families and the Department of Health Services. They continue from year to year. A number of funding, other funding pieces are annually renewed. The amounts may change, but they're annually renewed. But if the state wants to experiment with a new program or perhaps funding something new, then they'll do it for a time limited. So, and I will send you to make sure that you have the this list as well. But for instance, we currently have a family treatment court grant. We're in the 4th year of a 4-year grant period for that. And it was really designed for us to have a mechanism to implement a family treatment court program with the idea that if it was successful for us, we would be able to figure out a way to sustain it going forward. But you know that going in that they have a sort of a sunset date if that's the case. Our large, and we've talked a lot about it, our large community development block grant money that's going to emergency and transition housing, our planning grant for the housing study, those will end and sunset at some point in time, but we knew that going into them. A related program, we just received a grant for implementation of what's called the community health worker. It's a concept that's becoming pretty popular in a number of areas of practice in kind of the medical community development world. We have $120,000 16-month grant to hire a community health worker, and ours is focused, our person is focused at making some additional inroads towards making sure that we're connecting our Hmong community to the resources that are available to them. Hired a delightful young Hmong woman who's obviously fluent in Hmong and has just hit the ground running. But that grant, the state said, if it's successful, they will probably continue it, but it's kind of their pilot.
Anything else or any questions or comments for Chris? If not, moving on, we have 3 action items. The new board members should remember that each month we do not approve, but we note review of the vouchers paid. These are basically the bills for goods and services that the health department, or that, excuse me, that the Department of Human Services receives this month. The total is $262,431.95. I'll need a motion to note review of the April vouchers paid. Supervisor Steen, is there a second? Mr. Lamb seconds. Any questions? Any discussion? If not, all in favor, say aye.
Aye.
Aye. Any opposed? The vouchers for April are noted. 2 budget adjustments. The first is from Public Health. These are for car seat expenses. Do you want to elaborate?
Sure. So this is actually a grant that we get almost every year. However, I would say the kerfuffle of COVID, last year we did not submit the application. It didn't go into our budget. We didn't move through the car seats that we had. And so we were recognizing that we're coming up on our expiration dates for car seats. Also know that car seats expire. And we were able to submit a late grant application to the Department of Transportation, kind of tapping back into the dollars that we had been receiving regularly. So there is a match associated with this. We do have to put a little bit of levy towards it. I'm sorry, a little bit of program generated income towards it. So that's the $620. I have it in front of me, I promise. And we do that by charging a very minimal fee for the car seat for the individual. So that's what you're looking at today.
Okay, this is a budget adjustment. And again, these are dollars in and dollars out. I need a motion to approve. Supervisor Hagan moves, Supervisor Robinson seconds. Any further discussion? If not, all in favor say aye.
Aye.
Aye. The budget adjustment for Public Health is approved. And finally, budget adjustment, again, money in and money out for the Department of Human Services. Chris, do you have any additional comments to make? These are usually almost completely self-explanatory.
So this really ties back to Ms. Hall's question earlier. So a lot of times what happens is when we build a budget for next year, we're using it based on the allocation numbers from this year. And then as those allocations are updated, because that often doesn't happen until very late in the year or early into the following year, then we need to do a budget adjustment to what we thought were going to be the revenue to shore them up with what they actually are.
So this is a grant, and it's a adjustment in a grant total for the CDBG planning grant. Again, I need a motion to approve. Mr. Lamb moves. Excuse me. I got so excited. Ms. Parker seconds. Any further discussion? If not, all in favor say aye. Aye. Any opposed? the budget adjustment for human services is approved. And unless there are announcements, we are without objection adjourned. Thank you, everybody. It's been a busy week. And you've all done very well. Thank you all so much.
And I'm giving you a sunset with